My name is Michael Cain. I'm a cardiologist and I serve as Vice President for Health Sciences and Dean of the School of Medicine at the University at Buffalo in Buffalo, New York. I had the pleasure of co-chairing a session this afternoon on sudden cardiac death, and also had the opportunity during that session to give one of the presentations which focused on new insights into identification of patients at risk for sudden cardiac death. And during the course of the last 30 or 40 years, there has been an increasing number of diagnostic tests that purport to be able to identify those who are in fact at risk of sudden death. And some of the limitations of these methods that have been used to try to identify risk is their relatively poor positive predictive value. And so the approaches that are now needed to be used are to either look at some of these tests in combination, and there is a growing evidence of data that in using several of these tests, such as T-wave alternans and program stimulation, do in fact better predict those who will benefit from antiarrhythmic therapies. The second strategy is actually to look at new novel ways to identify risk for sudden death. And our group in Buffalo has been exploring using positron emission tomography to determine the extent of denervation of the sympathetic nervous system that occurs as a consequence of myocardial infarction. And the purpose of this most recent study was to determine whether or not the volume of tissue that is denervated, as opposed to the volume of tissue that is injured or hibernating, is a better predictor of risk for sudden death. And in a study of 204 patients who met modern day criteria for implantation of a defibrillator, these patients underwent positron emission tomography studies, and the extent of infarct tissue, hibernating tissue, and the volume of tissue that had denervated, had suffered denervation from the sympathetic nervous system was then quantitated and compared. And the major finding of the study was that, in fact, it was the volume of denervated tissue that was the best predictor of those patients who went on to die suddenly. And so the major conclusion of the trial was that this is a novel way to help identify patients at risk. It provides new information compared to the traditional methods during the last 40 years. And it also provides an impetus to do a larger scale trial prospectively to see whether PET imaging of denervated status of a ventricle does in fact improve our ability to better risk stratify.